My name is Tracy Ryan, and I'm the co-founder and chief communications officer of NKore BioTherapeutics. We're an immunotherapy and diagnostic company focused on bringing less toxic treatments to market for cancer patients in need. But my deep, deep desire to cure cancer didn't begin until 9 years ago when my daughter Sophie was diagnosed with a low-grade brain tumor called an optic pathway glioma. These tumors are very rare, and they have a 90% survival rate, but an 80 to 85% recurrence rate, meaning Sophie could be looking at years of toxic chemotherapies and clinical trials. And after learning that only 3.8% of all government funding was actually going to pediatric cancer research and that few advancements had been made in 40 years, my husband and I knew that we had to do more. Through a chain of events, we got introduced to celebrity and former talk show host Ricki Lake, who 6 months prior with her producing partner Abby Epstein had begun filming the documentary Weed the People, which is now on Netflix. This documentary followed 6 years of our life and the use of medical cannabis to treat Sophie's cancer alongside 4 other children that were also suffering from this terrible disease. And in the film and through Sophie's story, you can learn just how powerful this plant can actually be. On medical cannabis, alongside her chemotherapies, Sophie's immune function was not dropping like the other children that were in these treatments and that the doctors had treated before. After 9 months of being on very toxic chemotherapy and after having a very sick little girl, she just suddenly started getting better, and her bone marrow had somehow repaired herself, and she just stopped needing these blood transfusions, which her doctors couldn't explain and gave the credit to cannabis. She's had unexplainable vision recovery 3 different times, when all 3 times she was supposed to go blind. And we have had incredible seizure mitigation using cannabis alongside Keppra. She's had unexplainable healing after 3 major brain surgeries, where she had next to no swelling or bruising on her face when she otherwise should have looked like she'd just gotten out of a boxing match. Now, we knew we were onto something, not just because of what we were seeing in Sophie, but because of what we were seeing in other children. So we knew we wanted to do something to help change the world so it could be a better and healthier place to live in. That is when I really decided to dive headfirst into the science. When we knew Sophie was going to need another brain tumor surgery, we started looking for someone who could help us take that tissue and study it and implant it into mice so that we could use therapies against the tumor to find out what would work best for Sophie, since she'd failed so many therapies at this point. We got Sophie's brain tumor tissue and her blood to Dr. Anahid Jewett, who is the world leader in the field of natural killer cells. When I told Dr. Jewett about Sophie using medical cannabis, she was very intrigued, and she really wanted to learn more about her daughter and agreed to help us. When she looked at Sophie's blood, though, she could not understand what she was seeing. Sophie's immune function was 5x that of any healthy adult she had studied in 30 years. But yet Sophie was only 6 years old with an immature immune system, was on 4 chemotherapies at once, and had a brain tumor. It wasn't until a cyst formed in the pocket in which they took the brain tissue out of when they had Sophie's brain surgery that we were then required to drain this fluid that was causing headaches and seizure activity. Dr. Jewett studied this fluid and found that Sophie had no functioning natural killer cells in her brain. So that led us to look at 17 patients in Dr. Jewett's lab, where she studied the blood of patients consuming cannabis to try and understand what was happening. And in patient after patient, what she was finding is the natural killer cell system, which is our #1 defense mechanism against cancer, and which Dr. Jewett has proven when it fails is our first step in getting cancer. These systems were beginning to improve in these patients. So explained Sophie's immune function, but also helped us to understand that there was a blood-brain barrier issue that was keeping these NK cells from getting into Sophie's brain that could otherwise kill the tumor. People have often said that I am crazy, and I am, because I do truly believe that I can change the world, as does Dr. Jewett. So we formed NKore BioTherapeutics. We have developed a novel approach to activating and expanding or supercharging natural killer cells from young, healthy donors to create a cellular-based immunotherapy for the treatment of cancer. Now, these are Dr. Jewett's discoveries, and I say we because NKore now has the patents, and we're going to be working with Dr. Jewett to bring these therapies to market. This therapy corrects the deficiency in immune function that allows cancer to grow in the first place. And the supercharged natural killer cells have incredible killing ability, and they secrete more gamma interferon to induce differentiation. Now, what that means in layman's terms is it makes these very aggressive tumors less aggressive, so they're easier to treat. We have a proprietary approach to supercharging these cells It makes them last longer in the tumor microenvironment, so the treatment lasts longer. This combination therapy has been proven to be very effective in 350 humanized mice that are like having a tiny human model. And in one human patient, through a collaboration in Beijing, China, where non-Hodgkin's lymphoma was reversed in 14 days. We've recently published some incredible cannabinoid findings through our research in these patients as well. And we have proven that cannabinoids are also booting or rebooting the natural killer cell system and attacking and killing cancer stem cells, which are the seeds to cancer. We believe this is the biggest finding in cannabis research history, and we are hopeful that this is going to help people open their hearts and minds to a plant that you cannot die from, that has been shown to be far less addictive than caffeine and chocolate, and can help make the body healthier and repair the part of the immune system that you so desperately need in killing the cancer that chemo and radiation otherwise destroys. Given the incredible safety profile of our natural killer cells, we also believe that this is going to help lead us to a less toxic and way more effective cellular therapy for the treatment of cancer in patients. Our own daughter is receiving an activated natural killer cell therapeutic from her dad's own cells. Her immune function has grown 50-fold. Her energy levels are that of a healthy child. Her vision continues to improve, and she's only had 12 days of sickness in the last 8 months. We've used a probiotic that Dr. Jewett has developed called AJ4 alongside cannabinoids to continue to boost the activation of these cells. And what we are seeing in Sophie's body parallels with what we've also seen in our humanized mouse models. These NK cell therapies are harvested from her dad, and in the patients that we will be treating in the future will be harvested from healthy adults. Just look at these results. Her first infusion was in September, her second was in December, and now in May of 2022, we are seeing a 60% decrease in the overall mass of the tumor. Her cystic components are shrinking, which can be the most dangerous part of this disease. And multiple areas are just no longer taking up contrast. The tumor looks like Swiss cheese from all the necrosis or cell death. And her immune function and NK cell killing ability continues to improve. Now, can you imagine a world where your loved one's cure could be standing right next to them? That is exactly the world we are trying to create. But we need more funding for pediatrics and for patients like my daughter. We just need more funding for research, period. And with the help of the world at large, investors, politicians, grants, we hope to move these therapies through market as fast as possible because people are dying every day from a disease that we hope to reverse. Thank you so much for your time and for your passion in helping us on our very, very important journey to hopefully one day cure cancer. Thank you so, so much.